The information provided on the Forever Young Show by its host or sponsors is for educational and personal alternatives. Statements have not been established by the Food and Drug Administration. They are not intended to diagnose, treat, cure, or prevent any disease.
Welcome back to the second hour of the Forever Young Radio Show with host Carrie Knopfler, health journalist and fitness enthusiast, who is joined by health educator and executive producer Kelly Capasola.
Hello, everyone. So glad you could join us on the Forever Young Radio Show. If by chance you've just stumbled across our show on the dial today, our mission on Forever Young has always been the same, and that's to inform and educate every listener on healthier lifestyle options and good quality science-based information.
Indeed, and if you'd like to learn more about the show, there's a very easy way to do that. You just visit the website. Website is foreveryoungradio.com. That's foreveryoungradio.com.
Now, Carrie and I have a great show planned for you. We're going to spend some time talking about sleep-related breathing issues with a very special guest, Dr. Olmos. And we are going to share some very valuable information today. Sleep-related breathing issues just aren't affecting the adult population, but also the children's population. So make sure you stay tuned so we can get all the information that we need to potentially not only help ourselves, but the people we love in our life. I'm Kelly Capasola, and I'm being joined by Carrie Knopfler. Hey, Carrie.
Good morning. Good morning. I'm really looking forward to our show today. I think it's going to be just fantastic.
I am, too. And this seems to be an area where a lot of people are having questions about. So hopefully they get those questions answered today, and we learn more about how we can manage certain situations in our life. Again, we have a great show planned for you. If you get lost at any point in the show, please make sure you go and check out foreveryoungradio.com. We'll be right back with our very special guest.
I'm alive.
Welcome to Forever Young. Carrie Knopfler here, along with Kelly Capasola. We have a very special guest today, Dr. Stephen Olmos. He's been in private practice for more than 30 years, the last 20 devoted to research and treatment of craniofacial pain, temporomandibular disorder, TMD, and also sleep-disordered breathing. He obtained a DDS from the University of Southern California School of Dentistry, board certified in both chronic pain and sleep-related breathing disorders by the American Board of Craniofacial Pain, the American Academy of Pain Management, the American Board of Dental Sleep Medicine, and also the American Board of Craniofacial Dental Sleep Medicine. Dr. Olmos is the founder of TMJ and Sleep Therapy Centers International. That's because they have over 45 licensed locations in 7 countries dedicated exclusively to the diagnosis and treatment of craniofacial pain and sleep disorder. And a special guest for all of us today. Doctor, on behalf of Kelly and myself, thank you so much for joining us.
Well, thank you for giving me the opportunity to share some information.
Oh, it's great to have you with us. I mean, look at those accolades in the introduction. A lot of boards, a lot of American board that you have put a lot of time and education in. We appreciate that because as you continue to educate yourself over, the 30-plus years I'm sure you've been doing this, the more we can then translate that to people who have these issues. So I'd like to start, I think Carrie would agree, and really cover a little bit more about your experience and expertise in the breathing-related sleep issue arena because I think that's a rather new concept that hasn't had enough attention paid to it. Would you agree?
Oh, absolutely. In fact, I came to the realization of the importance of breathing in a circuitous way. I started early on treating chronic pain, and as we all do in general practice, we come in contact with people who, their faces hurt, jaws make noise, headaches, all sorts of neck pain, all these different kinds of problems. And no one ever seems to know what to do about them. So it's really quite frustrating. One of the things that was clear to me early on is that when people don't sleep well, they have less ability to feel better in the daytime. In fact, studies show the less sleep you have, the more likely you are to have pain in the daytime. So, an investigation of those things is really gave me the awareness that the whole idea of people needing to breathe is a fairly recent concept, recent in medicine, if you will, from, the 50s and 60s. We really didn't have much. The current, standard treatment for apnea as a CPAP machine wasn't even developed until 81. So in dentistry, these things are even more recent. So if you look at the history of medicine, and the understanding that it's important to breathe, which is the most vital component of life. It just seems odd to me that the most important thing that a patient needs to have evaluated is the last thing that's evaluated by most practitioners.
Wow. I know, obviously, that you mentioned the CPAP machine, that there's a lot of other therapies and treatments that are available for sleep disorders, but I just wonder, the number of people who have allergies, for example, has increased exponentially over the years, and I wonder are we having this more sleep disorders because of breathing today, or was it just unreported?
Well, I think previously it was both. I mean, we always had the understanding that obesity had a relationship to breathing disorders. That's the primitive thought process from years ago. Now we understand there's neurologic basis in collapse of the airway and anatomy of the airway that predisposes people to these problems. And certainly gaining weight will aggravate it. But I think the reason why we're seeing and recognizing the increase is that people have awareness now that there are more people just evaluating themselves, and of course the awareness generally for the professions. In dentistry, just last year was the first year that the requirements to become a dentist, the CODA requirements, initiated training in sleep therapy for the first time. So all dentists before last year, wasn't required that they got any training in sleep pathology. So this is all very, very recent stuff. We're seeing more because people are getting heavier. That's certainly one aspect. And to be honest with you, you spoke about allergies and you spoke about why we're seeing increases. Well, that has a lot to do with diet. We eat inflammatory things, and inflammatory things make us swell. And one of the primary places that we get swelling is in our nose. The nose is lined with erectile tissue, so when we eat things that are inflammatory, our nose swells and is blocked, and we start mouth breathing. And once we start doing that, a whole train of pathologic processes occur, and we understand now that the nose has direct effect on the apnea itself. So the more narrow the nasal passages are, the more likely the airway is to collapse. And so these are real important new concepts that we just didn't have a few years back.
Right, and I think it's interesting that you bring up the mouth breathing, and we've talked about this on the show for, we've been on air 16 years. I think in the last maybe 5 years we've talked about that. And a really good indication is whenever you travel somewhere and you go on a plane and you get up mid-flight you stretch your legs and you walk back to your seat, the amount of people sleeping with their mouth open, it's quite common, mouth breathing. And, some of the research that we've read, it can change the structure of the face. It'll show two twins in research. One is a mouth breather, one breathes normally during sleep, and how it can change that structure of the mouth overall in the face. So I'm glad that you brought that up, because I think that causes people some challenges overall. So when we talk about treatments and therapies for sleep disorders, what really is available out there to help relieve the suffering that people are going through?
Well, there's a whole myriad of sleep disorders. There's neurologic disorders, there's functional breathing disorders, there's obstructive components of sleep breathing. So when we talk about sleep disorders, what's interesting is the greatest greatest percentage of people who have a sleep disorder are the people who can't get to sleep. Insomnia is the primary and most common problem of sleep. Very often, it has origins in pain. For instance, 50% of the people who can't get to sleep are in pain. So the pain is very stimulating, keeps them awake. The other people, another mechanism is the people who have obstructive sleep apnea. That's where the airway closes when you're unconscious. So in those people, they literally stop breathing, they suffocate for a period of time, and so there's a protective mechanism. So the brain won't let the patient go to sleep because the brain realizes that when they do, they're going to suffocate. So there's a protective mechanism for some people. So we find that when we effectively treat OSA, then we can reduce insomnia in those populations. We've got all sorts of treatments nowadays. So, certainly we've got the CPAP, the positive pressure, but lots of people have issues with that, and compliance is low. There's surgeries. There's, for years they have cut away different parts of the body, but not understanding that the tongue and the jaw are movable, so you can only remove so much. And as you cut away parts, you actually make it harder to treat the patient. So oral appliances have been very effective and give a much easier way to go about life. I use an oral appliance for my apnea. The thing that people really are confused with, even sometimes people that treat it, sometimes they think that they have to make the airway bigger, but all people who have apnea are breathing while they're awake. The problem is when they go to sleep is when it collapses, when they're unconscious. So it's about preventing the collapse, and we find that if we're able to do that, we have to identify where those collapses are. So that's why we do screening. We do x-rays to be able to identify where the collapse points are and then have a very specific treatment. And sometimes the treatment is a hybrid therapy where maybe we use oral appliance, maybe some positive pressure. When you use oral appliance and positive pressure, you can reduce the pressures dramatically. And a lot of people who couldn't use CPAP now can in that combination. Sometimes we use oral appliance and nasal surgery. A recent study, or a study that's coming out very soon, Dr. Catalano from Boston University is coming out with a paper showing that nasal surgery can reduce sleep apnea by 50% in his population base. So we're seeing that nasal surgery and other types of treatment together. And then there's other kinds of things like implants for hypoglossal nerve stimulator. They put a device in your chest, kind of like a pacemaker that has a wire connecting to your tongue and stimulates the nerve for the tongue to push out of your mouth every time you stop breathing. So there's many, many different techniques. But as a patient or as a person who has this problem, and what I try to do is provide the simplest, most efficacious way to restore breathing. And as a person, that's what I want, and so that's what I recommend to my patients. So I found the things that are best adapted is really the process of less is more.
Listeners, please go and check out our website. That's foreveryoungradio.com. Again, foreveryoungradio.com. Click on that weekly highlight page, get a play-by-play of what we're going to be discussing throughout the morning. We'll be right back with our very special guest.
At Clear, the world's leading xylitol company, we are committed to delivering the safest and most effective xylitol products. Our xylitol is independently tested to ensure that purity and safety standards are strictly met. We are proud to have established the model of sustainability worldwide for the harvesting of xylitol, a plant-based sweetener that provides many health benefits. Unlike xylitol companies who harvest their xylitol from North American trees, depleting the environment and taking years for regrowth, we work with farmers worldwide dedicated to non-GMO crops as they harvest and extract the xylitol for our products. We take pride in our ability to help these local farming communities contribute to their economic success and wellness, as well as offering healthier choices to American consumers. To learn more about Clear, visit our website at xlear.com. Look for our xylitol products at your local natural products retailer today. Great for your health and great for the environment. That's Clear.
Welcome back to Forever Young. Kerry Nosler and Kelly Capasola here, and we're joined by Dr. Olmos. We're talking about breathing issues. And obviously, doctor, when you talk about breathing, you have to talk about, well, your nose. I mean, that's where we're supposed to breathe, right? And I wonder if people really understand just how important it is. They should breathe through their nose, and if they don't, just what's going on. So how do you lead people to an understanding of just how important the nose is?
Kerry, you couldn't be more spot on with those comments. It amazes me how little people think about the nose, that what is it for, this blob above our mouth. What is the function? Well, it's exactly what you said. It's our immune system. It's designed to filter, moisten, and warm air before you bring it in your body. It's your protective mechanisms. There is a gas that fills your cheekbones called nitric oxide, and every nasal breath draws that gas out and into your lungs. And that gas is antimicrobial. That is, it kills viruses, bacteria, and fungus. So every nasal breath is a protective mechanism to prevent you against respiratory infection. When you mouth breathe, you don't get any of that protective mechanism. Also, the nitric oxide is a peripheral vasodilator, and what that means is it dilates your peripheral blood vessels, so it lowers your blood pressure. So when you breathe through your mouth, your blood pressure goes up. And a lot of the people who have OSA and other kinds of breathing disorders have a high comorbidity or frequency of hypertension. So there's many mechanisms for that, but this adds to that problem. So breathing through your nose is essential. It is what is designed for that purpose. And when that's blocked, then you have to go through alternative pathways. So I have to explain to patients that, noses are for breathing, mouths are for eating, and you wouldn't stick food up your nose, or you shouldn't. In the same way, you shouldn't be sucking air through your mouth. That is not proper. And that's why we see a lot of the skeletal changes and development. You see, what comes first is the inflammatory component that then blocks the air passage, and then the musculature changes as the tongue position moves down and forward. So that's how people start developing their crooked teeth and their skeletal deficiencies, and the need for braces and these other kinds of treatments. So if you look at what came first, it's the inflammatory component, and that's why we have to look at then what causes inflammation? Well, the things that you come in contact with the most is what you consume, and so that's diet becomes a huge part of helping people be able to breathe better. If you eat inflammatory things, particularly dairy-type products, they for most people have increased mucus retention and problems in the nose, and so that leads to more obstructions. Inflammatory products like wheat and glutens are inflammatory for most people, and so they have issues with that as well. Most people don't realize that just sugar itself is inflammatory. Take wheat, for instance. Table sugar, a lot of people would say, I'm in a hurry, going to have some breakfast. I'm not going to use the jelly on the toast because, I'm going to be a little healthier here. I'm going to not do the sugar. Well, quite honestly, they'd be better off with the jelly and skip the toast because the toast has a higher glycemic index than the sugar does. So it'd be actually healthier to reverse that process. And I think most people just don't realize the inflammatory things that we come in contact that predispose us. So we have to look at what we feed our children, too, because this is where all of these problems start. And I tell people, okay, you've heard people, they've gone, 3 weeks without eating, 3 days without drinking water, but most people couldn't go 3 minutes without breathing. And so once we understand the priority of life, that breathing is the highest potential, then we realize that the value of breathing properly is vital to how our whole system works. And by the way, a nose that is blocked will also increase the likelihood of collapse of the throat, and so that can predispose people who are susceptible to obstructive sleep apnea, and that's some of the more recent ear, nose, and throat literature. The otolaryngology literature demonstrates how important the nose is. In fact, when we treat obstructive sleep apnea with oral appliances, the two biggest factors of success are BMI, body mass index, in other words, people losing weight, and nasal airway resistance. Those are the two biggest hurdles to having success when we treat people with oral appliances. So the nose is a primary factor in every treatment for obstructive sleep apnea.
What about irrigating the nose then? We have all kinds of sprays. People use a neti pot. They do different types of medications when they have blocked nasal passages. Some of them, they have a rebound problem after using it for a while. So what kind of a nasal aid would you suggest?
Yes, that's an excellent point. You see, because we have these inflammatory problems, if there's soft tissue, we want to shrink that tissue and open the airway. As little as a 1% increase in volume increases the flow rate to the fourth power. So small changes in the nose can result in great changes in flow. One of the products that I think has been the most valuable to me for my patients, almost every single patient, including myself, I use Clear, X-L-E-A-R, which is a xylitol and sea salt formulation. I'm currently working on a paper right now. We have a number of our centers. You know, we have almost 50 around the world, 7 countries. And we're doing a paper right now, and our preliminary research shows that after just a few minutes of application of the Clear product, that we get a 7% increase in nasal volume, which again to the 4th power is a very significant flow increase. And the thing is I like using things that don't have rebound. The reason why we use xylitol in that product is because it's antimicrobial. So again, it kills bacteria, viruses, and fungus like the nitric oxide. And you know when these things are most valuable, like you say, the neti pot and the rinses, those are for people that have had failed nasal surgery. Now, see, people have nasal surgery and they think that it's been improved. And sometimes it's actually been made worse because too many parts have been removed.
Yes.
The more current thinking with nasal surgery is to restore function, is to be minimally invasive. And so ballooning techniques and things like that are utilized nowadays optimally, as opposed to the more historical techniques of removing bones out of the nose. Sometimes that's necessary, but when we remove the walls of the sinus and the nitric oxide can now leak out, then those people are more prone to infections. And unfortunately, I see a lot of that, and that's why the Clear products are so important, because if you combine that with your neti pot and lavage that, keep it clean, keep the bacteria out. You're going to have to do that almost every single day, sometimes twice a day for some of these cases. It's an unfortunate situation because they've been made worse. And so we don't like to use antihistamines and decongestants because they have the rebound, as you mentioned. So that's very difficult. You get some benefit for a day or so, but then it actually makes the problem worse. So you have to keep changing products. And now if you go to steroids, then you get systemic steroid pumping through your body. It's amazing to me, the Flonase that is used, that has a circulatory levels of steroid, and that's really contraindicated in children because it'll actually arrest growth at the growth plates. And I know this is quite a commonly used product, so I try to steer patients away from these things and use more natural products. Salt water, but with the xylitol formulation is optimal. And these are the kinds of things you like to use on a regular basis.
Often when people will use these OTCs where they're trying to figure out, okay, gosh, why do I constantly have these allergies issues? Why do I constantly feel like my nose is plugged up and my ears are backed up? And then it stopped working. Maybe they got relief within, the first day or so. But then when they use those other products, that relief stops to work, and it seems that they just keep using it out of habit. What I like about the Clear line of products, especially the Clear Saline nasal spray, is that Dr. Jones, who has been on the show a number of times, always says, when you wash your hands, don't forget to wash your nose. I was the chronic kid who didn't feel good. I had to have tubes. I had to have my adenoids removed. 30 years later, I still remember my ear, nose, and throat doctor, Dr. Benz. That would show you how many times I had to visit him in the course of my childhood. So we want to find ways to be able to better manage those situations and to be able to offer the consumers ways to understand. So I love that you're joining us today because you're doing that very, very well. And I'd like to remind the listeners, you can, if you like what you hear about the Clear nasal products and you'd like to try them for yourself, you can find them at Vitamin Shop, Whole Foods, Sprouts, and other fine health retailers nationwide. They're also available at CVS, Rite Aid, and Walmart Supercenters. But for a list of retailers or to learn more about xylitol, if this is the first time you've ever heard of it, please visit Xlear.com. That's Xlear.com. Clear.com. Clear.com. It's featured on our weekly highlight page at foreveryoungradio.com.
Stop breathing right now. No, really, hold your breath. This is how it feels when you're stuffed up due to colds, flu, pollen, dander, postnasal drip, or any other reason. That's when you need Clear Saline Nasal Spray, the only spray with the power of xylitol. That simple saline solution you're using is only doing half the job. It's just rinsing. In multiple research studies, xylitol has been shown to reduce bacterial adhesion and help keep your nose moist and clean much longer than saline alone, making Clear more effective at washing away that nasty gunk in your nose. Clear is so powerful, it's been granted over 11 patents. So step up from that wimpy saline spray to something that actually works faster and better at getting you the relief you need to start breathing now. And if your doctor isn't talking to you about Clear for your congestion, maybe you need to get a new doctor. You don't just rinse your hands. Why would you just rinse your nose? Clear Saline Nasal Spray with xylitol. Available at Walmart, CVS, Whole Foods, Rite Aid, and everywhere else. Or Clear.com. That's XLEAR.com. Now go wash your nose.
Are you worried about your kids and family having too much sugar in their diets? Then switch to great-tasting Spry Xylitol Gums and Mints from Clear, the world's leading xylitol experts. Look for Spry Gum and Mints at Vitamin Shop, Whole Foods, Sprouts, and other natural products retailers everywhere.
I get wings to fly. Oh, I'm alive.
We're back with more on Forever Young. I'm Kerry Nosler, being joined by Kelly Caposola and our special guest, Dr. Stephen Olmos. And I think we've learned more, Doctor, about the whole area of breathing and breathing disorders and the function of the nose and diet than we've ever had before in terms of a complete analysis of that kind of situation. But I wonder as well, since you're up on the whole idea of restoring natural balance, there's so much work on the microbiome. I wonder if there's any connection that you found between people's bacteria, good bacteria hopefully, and breathing issues.
Well, absolutely. You can look at it from the digestive component, the leaky gut. That's a source of systemic inflammation from people who consume things that they're inflamed from. Are sensitive to, and they are predisposed to inflammation throughout their body, and a lot of times that manifests in the vascular swelling in the brain, migraine, this kind of thing. In the mouth, there's a very, very high correlation between periodontal infections and problems and mouth breathing and apnea. So, these are things that are a direct relationship. So the greater the problem with apnea, obstructive sleep apnea, the greater chance you have for the anaerobic bacteria that then cause your gums to bleed and your bone to dissolve away. So, basically anything you look at, any disease process has its origin in inflammation. I'd really like to talk about children because and how this affects them. That's one of the things that I spent the most time doing at the clinic at University of Tennessee, working with Le Bonheur Hospital, their pediatric hospital. They'd send over the kids that, were failing CPAP. And a lot of these kids started when they were at 5 years of age. They put them on these breathing machines. And, of course, the literature shows us now that those kinds of headgear, those masks that are put on with straps on the head, arrest the development of the child. It prevents the upper jaw from growing. So it actually magnifies their breathing problems as they get older. So I saw a lot of these kids who started out as mild apneics that were severe by the time I saw them when they were 10, so 5 years later. The important message here is that in adults, we usually manage people's apnea or suffocation for the rest of their lives, every night for the rest of their lives. In children, we have the opportunity to cure it, and I think this is a very important thing. A lot of the surgeries, you see, the problem is that the static surgeries and treatments that we have for adults, they don't work for children. See, the surgeries where you cut out parts, you really can't cut out too many parts. Tonsils and adenoids for kids, but you can't cut out the tongues, the throats, and all the other things you do for adults. The positive pressure, as I said, actually worsens their condition. Using oral appliances like we do for adults can't be used for children because that then arrests the skeletal and the dental development. Static techniques don't work for kids. You need functional techniques. And one of the things that I've published are orthopedic techniques of development where you reverse the process and grow the jaws, improve the airways. I published a paper of a child that stopped breathing 118 times an hour, and we were able to reduce that to 3 in 8 weeks by development changes. So we got her off her CPAP machine in 8 weeks, and this child was morbidly obese, was on antihypertensive medicine, was on chronic pain medicine, and and was also on type 2 diabetes, glucophage medicine. So these things can really be turned around, and I think that's the message we need to let people know. In terms of surgery, tonsils and adenoids, everyone assumes that corrects the problem. But the literature shows that if you actually if you do sleep studies on children, there's only been one study that's actually followed children with sleep studies for 3 years after they've had tonsil and adenoid surgeries, and they found that there's a 75% relapse. See, immediately when you take the tonsil adenoids, you obviously have opened the airway so the child, gets better. But if you follow the same child 6 months later, you're going to see an increase. So that's why, using these kinds of techniques like the saline sprays and the things we've spoken of and looking at diet and doing the developmental stuff will dramatically address these issues. So it's important that we treat kids early.
But also it kind of points out the fact that somehow modern science thinks that we're designed wrong. I mean, I realize the adenoids can have problems. You can have problems with your tonsil, but they're there for a reason. And so it would seem to me that trying to do whatever you can to restore the body's balance so that what we have works the way it's supposed to.
But that's it. Dr. Christian Guilleminault, who's the world expert pediatric neurologist specialist up at Stanford, who is the icon of sleep, says that, the swelling of the tonsils is the alarm system. It's the immune system telling you that something is wrong. And instead of just finding out what that is, we remove that part. So it's really, I equate it to patients all the time. I say it's like driving down the road and your engine light comes in your car and you have two choices. You can either pull over and investigate what's wrong with your engine, or you can simply pull the wire out of the sensor and it'll go off and you keep driving. The symptomatic removal of tissue is simply that. It isn't corrective. And literature shows us that it does not last long term. So we should really reevaluate those techniques because they don't last.
To be honest, we go to the doctor because we're struggling or a child is struggling. And as you alluded to, in an earlier segment, everybody has a different way of managing it. But I think the way that you're talking about is right on because, again, it gives the patient options. It's not that there's only one option and that option is surgery. And I think that can be very scary for people, especially when we're talking about young children.
I couldn't agree more. Later today, I'm going to give a webinar to dentists on how to treat obstructive sleep apnea in adults and children orthopedically, orthodontically. So these are the kinds of messages. Honestly, my mission is to educate. That's been what I've been consumed with for many, many years now. I just figured out that if I just sat here in San Diego and treated patients 24 hours a day, 7 days a week, there'd only be so many people I could help. But my mission has been to train dentists all over the world, and we've been able to extend the help many-fold. And so I'm so happy to get this opportunity to share these ideas with more people. I think the more people hear that there are easier ways to and have better outcomes, then I think so many more lives will be made better. So
Doctor, would the clear nasal spray also help people who snore?
Oh, absolutely. Snoring is just a variant of obstruction. I mean, there's not a lot difference between snoring and stopping breathing, suffocating, apnea. It's just a matter of degree. All the same parts are swollen, impacted, or collapsed. Bigger factor, as we've been saying, is the nose is a huge factor in that equation of how wide your throat is. It's called a startling resistor, theory. And so what happens is basically your nose has cartilage and your epiglottis at the other end of your airway has cartilage, and in between that is muscles. So if you narrow either end of that, you put greater pressure and your airway collapses greater. So by spraying your nose, it causes dilation of your airway, and so therefore that's why snoring decreases when you make sure your nose is patent or works more properly. And that's why those things need to be investigated. Sometimes it's soft tissue, sometimes it's a skeletal problem, deviated septum and other kinds of things. So those have to be evaluated as to what would work optimally for each patient.
Wow, and we are running out of time here. We wish we had 5 more segments. We could pick your brain all day about this. Really appreciate you coming on the show, Dr. Olmos, and I hope that you'll come back and share more information with us to help the consumers out there.
Kelly and Carrie, I love the opportunity. It's been a pleasure.
Listeners, if you'd like to learn more, please go and check out our website. That's foreveryoungradio.com, foreveryoungradio.com. Dr. Olmos, do you have a website that patients can be referred to?
Yes, we have tmjtherapycenters.com, and that's our international website, so it gives information about what we do, the education, all of our offices all over the world, so it would be a good center point to direct people for information from any perspective.
All right, listeners, go and check that out. If you'd like to find the Clear line of products, you can learn more at their website at clear.com, XLEAR.com, and they're also available. You can find the Clear nasal products at Vitamin Shoppe, Whole Foods, Sprouts, and other fine health retailers nationwide, as well as CVS, Rite Aid, and Walmart Supercenters. You can find that complete list of retailers, again, at clear.com. Listeners, it's been a great hour. It's gone way too fast. Be well out there.